Sometimes it's very difficult. Well, that's something that, yes, actually, I need to clarify. This is just an example of the aneurysms, because of course you can have them in the brain, as you are mentioning now. This is just one case. Um, it depends on the place the aneurysm is located in the brain, that may cause different symptoms. Sometimes it is very similar actually to a migraine. Sometimes it's to another type of headache. Unfortunately, uh, it manifests to a point that we are able to diagnose it when it simply bursts. That's the bad news about it. Usually, that's how we find out. Usually doesn't have any symptom until it bursts. So depending on the place it was located, it's basically going to be similar to a stroke. It's actually going to be a stroke. We might be able to find it without it having to burst, but usually are what we call incidental findings, that we were looking for something else and we found an artery that had an aneurysm. But it's impossible to know like a regular headache from an aneurysm. Of course, in the webinar, I talked about the emergency room. I said certain things about headaches that you should see. For example, having the worst headache of your life, um, having a headache that is usually different from the headaches you always have. For example, I have migraine, and it's always in the right side of my head, and suddenly I have it on my left. That's something that should tell you that something might be wrong. Or simply having vision changes, changes in the way you speak or move, things like that.